Welcome, doctors and healthcare providers. If you're here, you're probably working on getting Medicare to approve Botox treatments for one of your patients. Whether it's for chronic migraines, muscle spasticity, or something similar, we all know the prior authorization process can feel like a lot of hoops to jump through. But don't worry, I'm here to walk you through it, step by step. So, first things first. Medicare can cover Botox under Part B, but only if it's medically necessary. That means conditions like migraines, overactive bladder, or severe muscle stiffness might qualify. But cosmetic reasons, like smoothing out wrinkles, Medicare won't touch that. Their focus is on treatments that improve a patient's health. Now, why does Medicare require prior authorization for Botox? It's because Botox isn't cheap, and they want to make sure it's the best option for your patient. Basically, they're asking, have other treatments been tried first? Did they fail or cause side effects? That's where your documentation comes in. It's all about proving medical necessity. Here's how you can handle this process smoothly. Step 1. Talk to your patient and gather all the details about their condition. You'll need to show that other treatments have been tried and why Botox is the right choice now. This could include failed medications, intolerable side effects, or other challenges your patient faced. It's your job to build a strong case. Step 2. Submit the prior authorization request. Your office will need to fill out the forms for your Medicare administrative contractor, basically, your region's Medicare office. Include everything: a letter of medical necessity, medical records, and any evidence that supports your case. Trust me, being thorough now saves a lot of time later. Step 3. Show proof of what's been tried before. For example, if this is for chronic migraines, Medicare might want to see documentation of previous treatments, like preventive medications. If those didn't work or caused problems, highlight that. Make it clear that Botox isn't the first option, it's the necessary one. Oh, and don't forget about coding. Medicare runs on accurate ICD and CPT codes, so double-check them. If this is for migraines, you're probably looking at ICD-10 code 𝗕43.709 and CPT code 64615 for the Botox injections. These little details can make or break your submission. Once everything's submitted, Medicare usually takes about 2 weeks to review. During this time, they might ask for clarification or more documentation, so stay in touch with them. And if they deny the request, don't panic. Many denials happen because they just need more information. Appeals are common, and with the right additional documentation, approvals often come through. So, here's what I'd say: stay organized, stay thorough, and don't hesitate to push back if needed. And if managing all this feels overwhelming, that's where outsourcing can really help. At Staffingly, we specialize in handling prior authorizations. We take the paperwork, the follow-ups, and the stress off your plate, so you can focus on your patients. With 24/7 support and big cost savings for your practice, we're here to make things easier for you. If you'd like help managing prior authorizations, give us a call at 800-489-5877 or email us at support@staffingly.com. We're here to support you every step of the way.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.